We can start now. Good morning, Excellencies, Director, AD, Dr. Salas, ladies and gentlemen, our participants in the room and online with us today. Welcome to the 22nd celebration of Vaccination Week in the Americas. My name is Luciana Villegas. I'm a Public Affairs Advisor at PAHO, and it is my pleasure to moderate the session today. A few housekeeping points before we start. We have interpretation available in all 4 PAHO languages: English, Spanish, French, and Portuguese. And you can access the ones in the room through the headset on your desk or chair. For the ones online, you just have to look for the interpretation function on YouTube or Zoom. Excellencies, ladies and gentlemen, for 22 years, the countries and territories of the Americas have protected individuals, families, and communities through Vaccination Week in the Americas. The week-long annual initiative, usually at the end of April, has helped to vaccinate 1.15 billion people in more than 40 countries and has supported the elimination of polio, measles, and rubella, among other diseases. We are here today to launch the Vaccination Week at PAHO, to celebrate it, and the week will run until the Sunday, 27th of April. The slogan for this year's Vaccination Week campaign is "Engage now to protect your future, get vax." The idea is to highlight that vaccines are an essential part of a healthy and active life. This morning, we will hear from senior health authorities from the region and share experiences in a roundtable discussion with the PAHO director and a panel of distinguished guests. We'll start with an introductory video with more information on the campaign for this year, and then go on for an overview of the vaccination coverage in the Americas. Please, we start with the video now. Thank you.
La Semana de Vacunación en las Américas se ha convertido en el movimiento más grande de la región en favor de la vacunación desde hace 22 años. Con más de 40 países y territorios participantes y la generosa contribución de socios y donantes, hemos logrado un hito extraordinario. Más de 1.15 billones de personas vacunadas y la eliminación de 6 enfermedades en nuestra región. Cada año, los profesionales de la salud llegan a los lugares más remotos para unirse a miles de personas que celebran la seguridad y la protección que traen las vacunas a sus vidas. Los esfuerzos de los países por recuperar las coberturas de vacunación durante la Semana de Vacunación en las Américas ponen de manifiesto su determinación para construir comunidades más fuertes y saludables. Este es el momento para asegurar un mañana más seguro para todos. La inversión y el fortalecimiento de los programas de inmunización debe continuar para proteger a las poblaciones de las amenazas latentes. La vacunación es un compromiso por el bienestar y la salud de las Américas. Actuemos ahora y protejamos el futuro de todos.
Thank you. Very inspiring, touching tribute as well to one of PAHO's greatest vaccination champions. I would now like to give the floor to Dr. Salas. Dr. Salas, Daniel Salas, is the Executive Manager of PAHO's Comprehensive Immunization Program, and he will give us an update on the coverage of the region, the immunization coverage, as well as on PAHO's revolving fund support to our member states.
Okay, good morning, ladies and gentlemen, and our director, our assistant director, Luciana, and everybody that is present here. We're going to remember that when we're talking about vaccination, about vaccines, we're not talking about a regular intervention. Here, we're talking about an investment that is going to have one of the highest return. When we invest $1, we're going to receive it multiplied several times. So this is to remember as that this is a life-changing intervention. When we talk about the achievements in disease elimination, you can see there are successful paths to eliminate many of the diseases that are vaccine preventable in the last decades in the America. And what does it mean? I mean, what is the importance of having this elimination? It means that we have no more children, no more adults that are deaf or blind, paralyzed, skin scarred, dead, or with encephalitis, meningitis, with pneumonia, or hemorrhages, and many other complications that can present you to these diseases, to this virus, to these enemies, public health enemies. And the one question is, what is the next disease that we're going to eliminate? Is it going to be cervical cancer? I mean, we need to increase the HPV vaccination coverage if we would like to get there. Historically, the Americas has been used to lead in terms of vaccination coverages among all the WHO regions. But there's been a dangerous setback during the last probably 10 years. And this means, for example, in 2022, you can see that there was a slight increase, but it still means that we have 2.2 million children less than 1 year in the Americas that did not receive all the vaccine doses that it was expected to receive. So at the end, we see that recovery is ongoing. And you can see this chart, all the antigens during the last year presented a increase, a slight increase in some cases, a more important one in other cases, except for the measles-containing vaccine, the first dose. But we still need to get to the 95%. That's our goal. That's the goal that we have set ourselves here in the Americas. But unfortunately, so as we were talking before, many are still left behind. And you can see in this chart, then in the last year, in 2022, we had close to 2 million children that were under-vaccinated. Of course, the zero dose represents a lower number, but remember that we need not just to start the first dose. Is very important because it represents that we are catching the kids, that the system is not forgetting them, but we cannot forget them in the road to complete the vaccination schedule. Because at the end, it is important to start, but it is important to end, to finish that schedule road. And we would like to address an important topic today, which is what is happening with measles. As you can see, in the Americas, we got a resurgence of measles in 2018, and mainly because the circulation, the transmission reinstated in Venezuela and Brazil, we had important, challenges there. But fortunately, because these countries have made a lot of efforts, we can see that the numbers of indigenous cases, the indigenous transmission, started to get to close to zero. And now in 2023, Venezuela has been re-verified as a country free of measles transmission. And we are expecting Brazil to be the next country next May. But the thing is that during 2023, we had 72 cases, imported cases of measles in this region. And guess what? In 2024, this year, probably this week, we're going to have more than 200 cases, imported cases, just this year. So we have seen this reactivation of transmission of measles, but these cases are important ones. I mean, it means that they come from other regions in the world. And of course, to have an imported case of measles, I mean, it is somehow expected to have that case because we cannot get the 100 population vaccinated. But the important here is to have acute surveillance systems to detect in a timely way that case. And that case doesn't find, a bucket of unvaccinated persons or people, because it can, be a start of an outbreak or something worse. And you can see in this slide that for the first dose of measles, MMR, we have been low. I mean, we had 85% in 2021, 85% in 2022, and you see we need to reach the 95%. And that's why we need to have these follow-up campaigns, and we have migrated to a high-quality model of trying to catch in the really ones that are unvaccinated. And you can see that for the second dose, the coverage are not as well. Some of the key regional challenges that we have ahead of us. Of course, one of the most important one is the political commitment. If we are saying that vaccines represents one of the highest return when we make this investment, we should have the governments to prioritize these high cost-effective interventions. That's going to translate into more resources to reinvigorate the essential services. And of course, we need to adapt the health services offer, because the families have changed how they work, how they function in the societies, but the health services mostly remain with the same offer. So we need to update that offer to really get to the unvaccinated. And the vaccine acceptance, we saw during the hesitancy increase in COVID-19 pandemic, but we are afraid that that may spill to other vaccines. And just some words about the revolving fund. The revolving fund has 43 years of existence, and it reaches 41 member states are using currently the revolving fund. Just in the last 2 years, 130 million people in the region received at least one dose procured through the revolving fund. And we have more than 76 products related to vaccination, to vaccines or vaccinations. And that represents 50% of savings. So some of the opportunities and landscape overview is that the revolving fund has the best prices for middle-income countries and maintains its commitment to affordable price. And that means competitive and health vaccine markets. It seeks to optimize product portfolio and increase solidarity and partnerships to enhance access to new and upcoming vaccines. So it means coverage and more lives saved. And it supports additional manufacturing partnerships to promote supply chain resilience, and that it's going to translate into less dependency on external sources. And finally, to boost the digital agenda to achieve more efficient processes, which is going to mean improved and informed decision making. Thank you very much. And our message for this Vaccination Week in the Americas is engage now to protect your future. Thank you.
Thank you, Dr. Salas, for the very informative presentation. Some sobering figures there about children's vaccination in the region. Food for thought for all of us. We will now continue with the interventions from our member states. We will start with a video message from Ambassador John Nkengason, Director of the Bureau of Health Security and Diplomacy at the United States State Department.
I'm excited to join you for the 22nd Annual Vaccination Week in the Americas and to celebrate the critical role PAHO plays in augmenting national immunization programs. Vaccination is one of the simple, cost-effective ways of preventing disease and improving health outcomes. Every year, PAHO leads the regional initiative to promote equity and access to vaccination in all countries in the Americas. And over the course of 2 decades, 1.2 billion people of all ages have been vaccinated through this PAHO-led effort. This is a tremendous life-saving accomplishment that has allowed men, women, and children to lead active and fulfilling lives. The United States is a proud partner of PAHO and member states, and we invest about $59 million annually in PAHO to promote disease control, elimination, and eradication. This year's theme, Engage Now to Protect Your Future, is a call to action for all of us to seize this moment to rebound from the negative impact of the COVID-19 pandemic on immunization rates, especially amongst children. Political will and the steadfast leadership from PAHO will help us increase immunization rates and continue saving lives. The goal remains to close the most urgent immunity gaps and promote vaccination across all age groups. I believe we can get there together, and you can count on our support and partnership to make it happen. I would like to thank Director Barbosa for inviting me to address you, and I thank the PAHO staff for their hard work and dedication to public health, both here in the Americas and worldwide. Thank you.
We thank the ambassador for this supportive message to Vaccination Week in the Americas. I now invite you to watch a message from Dr. Mary Munibe, Vice President and Minister of Health of Costa Rica.
Hola, soy la doctora Munibe, vicepresidente y ministra de Salud de Costa Rica. Para mí es un placer enviarles este mensaje en el marco de la celebración de la Semana de Vacunación de las Américas. Y me enorgullece mucho contarles que Costa Rica es un país que ha mantenido altas tasas de vacunación a lo largo de muchos años, gracias a acciones que se han venido realizando y permitido una protección y un impacto positivo en la salud de la población. En primer lugar, este esfuerzo no ha sido exclusivamente llevado a cabo por el Ministerio de Salud, sino también con la Caja, y ha contado con la participación de la población, que reconoce la importancia y necesidad de vacunarse. Es gracias a esta colaboración conjunta que mantenemos estas tasas de cobertura. Otra estrategia es el hecho de contar siempre con vacunas en el país, las cuales han sido precalificadas por su seguridad, eficacia y confiabilidad, y tener este stock suficiente para que la población tenga acceso a ella mediante los servicios de salud. Es crucial destacar la vigilancia activa que se lleva para estas enfermedades prevenibles mediante la vacunación, así como el papel fundamental que desempeña el sector privado en la administración y registro nominal de estas vacunas. La identificación de las personas que cuentan o no con vacunación también nos ha permitido hacer un seguimiento efectivo de ellos y así completar los esquemas de vacunación. La parte operativa de la Caja, por ejemplo, tiene a los ATAPs, que son estos asistentes técnicos en atención primaria que distribuyen las vacunas en sus visitas a la comunidad. Y así se garantiza que toda la población reciba las vacunas necesarias, incluso desde su hogar. Para el Ministerio de Salud es muy importante continuar con estos índices de vacunación, por eso trabajamos en la interoperabilidad, para que en los próximos meses se pueda contar con toda la información de vacunas aplicadas, tanto en el sector privado como en el sector público. Por último, quiero enfatizar que la vacunación es una herramienta invaluable para prevenir enfermedades y así mitigar el impacto negativo que éstas ocasionan a la economía del país. Nuevamente, la prevención evita aumentar costos asociados al tratamiento y la gestión de enfermedades evitables. Como lo dice el lema este año, actúa ahora para proteger tu futuro. Vacúnate. Instamos a nuestra población a vacunarse y así asegurar un futuro saludable. Muchísimas gracias.
Thank you, Vice President Munibe, for the message. Is good examples of efforts to reach the last child. We will now hear a message from Dr. Nízia Trindade, the Minister of Health of Brazil.
Vaccination is one of the most effective measures to prevent the incidence of a number of diseases. Brazil supports the Vaccination Week in the Americas that promotes equity and access to vaccination in all countries of the region. Brazil last year launched a national movement for vaccination to recover the confidence in vaccines, promote a culture of vaccination, and to protect our society. As a result, we have noted an increase in vaccine coverage in 13 of the 16 main vaccinations and the National Program for Immunization schedule. Following 7 years, we have reverted the trend that was a decrease in vaccination coverage observed since 2016. I would like to make a call for us to all work together in the Americas to combat the vaccine resistance, which unfortunately has spread in an irresponsible fashion. In 2024, Brazil became the first country in the world to offer vaccines against dengue in the public health system. This is a true achievement that fills us with pride. We also approved application of the VPH vaccine in a single dose following the recommendations of the WHO. We launched a vaccination program at schools in collaboration with the Ministry of Education, with a perspective of improving child vaccine coverage and to reduce the number of diseases that started to reappear in recent years. This month of April, we're launching in Brazil the month of vaccination for indigenous peoples. We launched this project in the Quahi village in Waipapoque province to vaccinate indigenous peoples throughout the country. I'd like to end with a message for all that to vaccinate is an act of life and of love and protection. Thank you very much.
Thank you, Minister. Obrigada for your message. We now move on to our roundtable discussion. We have a distinguished panel, including the PAHO Director, Dr. Jabez Barbosa, and our Assistant Director, Dr. Rhonda Seeley-Thomas. We also have connected with us online today the Honorable Kevin Bernard, Minister of Health and Wellness of Belize, Dr. Jimena. Hello. Thank you for connecting with us. We also have Dr. Jimena Aguilera, Minister of Health of Chile. Hello, Dr. Aguilera. And we have Dr. Jesus Osteocochea Suarte, Vice Minister of the Collective Health Networks of the Ministry of Popular Power and Health of Venezuela. Welcome and thanks for connecting with us today. We will start with a question to the Honorable Kevin Bernard. Minister Bernard, recently Belize has achieved the highest increase in vaccination for children younger than 1 in the region of the Americas. How did the country go about to achieve that? What were the main obstacles that you faced? If you could tell us a little bit more.
Thank you and good morning. First of all, let me thank you all for the opportunity. And our goal, of course, is to achieve a minimum of 95% vaccination coverage of any of the vaccines at our national vaccine schedule. No doubt, COVID-19 pandemic with movement restrictions to contain the spread of the virus had a negative effect on the vaccination coverage. For example, the MMR first dose coverage was reduced from 95% to as low as 79%. In this case, however, we went back more than 23 years. We have a cadre of committed, dedicated public health nurses and rural health nurses who have gone the extra mile to vaccinate the unvaccinated. And so one of the strategies the various strategies that we use, one is that we have been able to do routine and everyday vaccination. We prefer that over the campaigns. We prefer to do routine vaccinations. Our vaccinations are administered at the health facilities and during when we go out on the mobile clinics across the country. Another thing that we try to ensure is that vaccines are treated as a public good. So the ministry provides vaccine both to the private sector and the NGO health providers, so that they are able to then vaccinate their clientele at no extra cost to the vaccines. We have also ensured that the opening of the multi-dose BCG is authorized regardless of the number of neonates that are to be vaccinated. We also moved from vaccination on just specific days to include walk-ins at our health facilities. And we have seen that that has also made a great impact in terms of our vaccine coverage. Our home visits are also conducted for children pending vaccination. There have been a rigorous effort by the Ministry of Health to ensure that we are reach out to our communities, especially for those children who have not been vaccinated. We do continue to conduct many campaigns in communities, especially those communities that has low vaccination coverage. And we also do many campaigns on weekends in selected communities across the country, especially in those areas of the country that are low in terms of coverage. Our newborns receive the BCG and hepatitis B birth dose before hospital discharge. And so we have seen that our skilled birth attendance rate is now at 96%. And so I want to end by saying that we acknowledge, of course, the support received with our partner agencies, the hiring of additional nurses and support staff, or improved cold chain, access to vehicles and efficient data collection utilizing the apps. And so thanks to UNICEF, to PAHO, IDB, Salud Mesoamerica initiatives and the World Bank, they have all been able to assist us in contributing to our vaccination coverage recovery.
Thank you, Minister, for your contribution. I might have some follow-up, but before that, I would like to connect with Dr. Jimena Aguilera from Chile. Dr. Aguilera, Chile has the highest proportion of the population vaccinated against COVID-19. What are some of the lessons that we can take from this success, and how could they be applied for your next immunization goal?
Well, for starters, good morning, everyone. It's a pleasure to take part in this week of vaccination for the Americas, recognizing the best of the health tradition of our continent. We have been successful regarding the COVID vaccine coverage. However, we did face a number of challenges. I believe in Chile, we were successful understanding that vaccination is a public good that protects people's health, the health of all people, as Dr. Salas said in his remarks, and that it is a right that we are granting everyone in Chile with all of the different vaccines, eliminating, for example, smallpox, polio, and other diseases. We've been quite successful. Now, the work or the it was a very big challenge to achieve the COVID vaccine and also to roll out the first applications of the vaccine. But now we're at the fifth booster shot, and we are focused on vaccinating the at-risk groups, the most vulnerable groups. One of the things that help us the most is our tradition of primary health care as the channel through which we apply broadly vaccines throughout the different territories of the country. And the leadership, not only at the health ministry, but in a cross-cutting way through all the different authorities and levels of government that support the vaccination effort. That said, at the national level, we still face challenges trying to enhance the coverage of vaccination against COVID-19. One of the things that affect us most is that there are people who push back against vaccination, who are against it. Sometimes in our vaccination campaign against influenza, the flu vaccine, which we started at the end of March and April this year for the first time, we are using the vaccination against syncytial respiratory virus. But the success of the past against COVID does not mean that we can drop our guard and feel that we're safe and that we're always going to achieve the same vaccination rate. It's an ongoing effort to make sure that everyone is vaccinated, especially the at-risk groups. Now, in the case of the health ministry, what affects us is that when there's a spike in COVID-19 cases, that usually coincides with the spring and the summer, in which people have pretty much thought about autumn being the time when you ramp up vaccinations in preparation for the winter season. So we need to keep up our communication efforts to bring down barriers to access. The sound has been lost, says the interpreter. We have no sound in the booth. There is no sound in the interpreting booth. Now, in the case of Costa Rica, we also are stepping up vaccination among the elderly. We're also trying to bring down other barriers to access to vaccinations. Thank you.
Thank you very much, Minister. I now pass on to a question to the Vice Minister Ostecochea de Venezuela. Vice Minister, Venezuela achieved recertification as a measles-free country this past November, following outbreaks that started in 2017. Congratulations, first of all. That's quite an achievement. What did the country do to reach this goal?
Good morning, everyone. I greet the director, Barbosa, and everyone on the committee. Venezuela has been making efforts to step up the extended vaccination program under the health ministry and of popular power. In 2023, in November, we were re-verified as a country free of measles by the regional committee. Now, it's very important to stress that this was an effort after 4 years in which the country had no cases of measles, owing to the fact that the country stepped up its epidemiological surveillance throughout the national territory, active surveillance, not only in those hotspots where there were outbreaks, but nationwide. Venezuela worked with the comprehensive health care providers we have 593 of these community health hubs. More than 300 cities are included, covering the entire territory of Venezuela, in which we carry out active epidemiological surveillance, and we have a rapid response team should there be any suspicion of measles. And we again put together this rapid response team. We do have in our country the ability, we have an internationally certified lab that is capable of carrying out these tests immediately when we have a suspected case of measles. That means any suspected case within the community of measles, we can act quickly. Or if it's an imported case, so we can act quickly and keep it from spreading. And thus far, since we started that, we have not had any more positive cases. It's also worth stressing that we have increased our coverage for the MMR vaccine for travelers as well, so that we can rein in any type of outbreak. Now, this comprehensive community system, the fact that we have it and that we've reactivated it and kept it up, whenever there's a suspicion of a new case. Now, in this certification program in 2024, we have improved, and we now have the ability to work under micro planning schemes through the 593 different cities under the comprehensive community program. And that has enabled us to broaden our coverage. And so we are working toward achieving 95% coverage, not only with MMR, or rather, yes, MMR. And so we have been able to sustain the broadened immunization program with 8 vaccines that make up our overall schedule. But that vaccine also protects against those diseases. But as Venezuelans believe firmly in vaccinations, accept vaccinations as a means of protecting oneself, in 2024, we worked on introducing a new vaccine against pneumococcal diseases and rotavirus. And we have been able, and the VPH, and so all of the micro planning that we're doing to guard against new outbreaks. We have not had any yellow fever outbreaks. And so we have been able to keep up through all the different international agreements that we have that have been handled from the presidency on down, to keep up the cold chain and to make sure that we can keep a sustained rollout of vaccines. In 2024, we're going from 5,000 to 7,000 vaccination points, with 1,000 new professionals joining the team who will be focused only on vaccination in the border regions and the hardest to reach regions where access was always a bit difficult. So that we can ensure that throughout the region, we can avoid outbreaks and close the gap, the coverage gap in our immunization effort.
Thank you, Vice Minister, for your answer. I would now like to invite the PAHO Assistant Director, Dr. Rhonda Silly-Thomas, to tell us a little bit, a question for you. How has PAHO supported countries to improve performance of national immunization programs?
Thank you. Good morning to everyone. As we all aware, the vaccination program is a flagship program for the Pan American Health Organization. And as such, we support countries. It's an organ-wide support that is provided for countries, from the level of AXM to the level of the country where we have field workers in vaccination. Also, it's in the Pan American Health Organization, all departments, either directly or indirectly, support the national vaccination programs in our member states. But more specifically, we have a special program on immunization and a regional revolving fund that directly support countries in immunization. And I'm going to focus on those, that department and the regional revolving fund in my response. So since 1977, the regional immunization program here in PAHO has supported countries and territories by promoting consensus and action among member states on common elimination goals for vaccine preventable diseases. And in that regard, every year, PAHO hosts the expanded program on immunization program managers and an annual meeting where they focus on those goals and strategies. Also, we generate strategic and operational guidelines that are adapted to the regional context. PAHO provides technical and financial support to national immunization programs, and we employ state-of-the-art strategies and tools to find and reach unvaccinated and undervaccinated children and adults. And it's not only state-of-the-art strategies and tools, it's activities such as this, Vaccination Week in the Americas, where we find gaps in immunization coverage and target unvaccinated persons. We apply new performance monitoring tools to identify gaps and improve performance. The other department that focuses and supports countries in their immunization programs is the revolving fund for access to vaccines. And in that department, they provide access to safe and quality vaccines at affordable prices for countries and territories throughout our region. And this has greatly contributed to the sustainability of national immunization programs, since 95% of vaccines are purchased with national funds. The Regional Revolving Fund also helps countries and territories to generate savings of up to 50% in the cost of vaccines, injectable materials, and cold chain equipment through 76 products that are offered. In 2023, 180 million people around our region received at least one dose procured through the revolving fund. So today, as we launch Vaccination Week in the Americas, I want to thank member states for continuing to work with PAHO as we seek to achieve increased vaccination coverage for the peoples of the Americas. Thank you.
Thank you, Assistant Director. I now have a question, Dr. Barbosa. We heard from our panelists about some of the challenges that are persistent, also for COVID-19, people not wanting boosters anymore. What would you say are some of the persistent barriers to vaccination that we see in the region of the Americas, and perhaps some strategies, recommendations to overcome these?
Thank you, Luciana. Good morning, buenos dias. First, I want to thank all the ministers that are participating in this roundtable, and the ministers that all send their very inspiring videos, reaffirming their commitment to this. I think that one of the most important public health measures that we have, that's keeping vaccination, protecting our children, protecting our population, saving lives in our region. I think that we have three main barriers that we need to reflect about them and how we can establish a proper strategy. The first one is how we can keep the priority for the vaccination initiatives, programs in each country in our region. Because sometimes it's, when we look to the public health scenario that you have nowadays, first you have several different priorities that are competing. The scenario is not the same as it used to be 30 or 40 years ago. Second, some of the success of the immunizations, of course, they have a positive effect because they saved the millions of lives and diseases in the region, but at the same time, many families now think, why do I need to vaccinate my children against the polio? Because polio was eliminated. Why do I need to keep vaccinated against measles? I don't know any family in my community that has had measles or polio cases in the last decades. So we also need to think how we can keep the priority and how we can translate the priority into concrete actions, into plan of actions that can address the gaps that we have in different countries because they are different. So when we ask for a prime minister or a president to keep immunization as a priority, I think that if this person, this prime minister or president accepts it, they should ask us, okay, so tell me what to do tomorrow. Tell me what to do to recover from the impact that you had from the COVID-19. Tell me what I need to implement, and we need to have the answer. And this answer needs to be based in the best evidence that we have. Need to be based on the clear assessment of how is the situation in the country, and it needs to be very clear about what are the gaps that you need to address. So I think that this is one priority to keep vaccination as a priority, reflecting both in the budget, but also in the engagement, not only from the government, but also from the communities. I think that is one of the main barriers that we need to overcome. The second one is about the barriers that we have in the region. Remember that when Vaccination Week was launched 22 years before, it was aiming to reach populations that were living in remote areas, on the borders, among countries, indigenous population. And these groups, of course, remain as a very important priority that we need to develop a specific strategy to guarantee that they have their right to get their vaccines. But at the same time, during these 22 years, another very important group emerged, and they are the most important responsible for the numbers, decreasing numbers that we see in the coverage, in the vaccination coverage. These big slums in the big cities, slums where poverty and violence sometimes don't allow people to have access to health services that have not modernized the way that they are working. So they open only Monday to Friday, 9 to 5. So families where both adults are working, they don't have the opportunity to bring their children to be vaccinated. So now we needed to add this other group. So Vaccination Week in the America is not only to reach and to offer vaccines to people living on remote areas. They are still very important. But if we don't add this other very important priority group, we will not recover from the decreasing number in the coverage. So we need to rethink. We need to review the semi-barriers that are preventing people to have access to many important public health interventions, and based on good information that sometimes is still not available. We need to modernize also the national immunization program, because in many countries, unfortunately, for COVID-19 vaccine, we can have the information on the cell phone. People that got the vaccine can have the information on their cell phone. But for the routine immunizations, they are still recorded on the old cadernetas de vacunación, in paper that don't provide, and this kind of information, they don't provide for the municipalities, the states and provinces, for the Ministry of Health, the real information about who has been vaccinated and who is still missing to be vaccinated. And without this information, this is a kind of a totally blind flight that we are taking, because we cannot identify what are the groups that are not being vaccinated. And without identifying them, we cannot adopt a proper strategy to overcome these barriers. So we have already seen in recent years many important initiatives that the local governments, that the national governments are adopting to remove these barriers and to guarantee the access of this population. I could witness some of them in Brazil, in Argentina, in Mexico, in other countries that I have visited last year. And I think that this is a very important part of this recovery process that we have already seen, in the numbers that Daniel Salas presented, but the recovery is still at the beginning. We still need to work hard. We need to improve our strategies. We need to improve our national plans in order to provide the protection that we need in the countries. And finally, I think that this topic that some of our ministers and panelists have already addressed, that the vaccine hesitancy. I think that we cannot put an equal sign between vaccine hesitancy and anti-vax movements. They are totally different things. Anti-vax movements, groups, they are a very small part of the population, and for different reasons, political, ideological, conspiracy theories, mental health issues, I don't know, many of them, some of them at the same time. These people, they don't want to be vaccinated. They are against vaccine, they are against medicines and many other things. But the society evolved a lot in the last decades. And now, a very important proportion of the population, some surveys have estimated around 15 to 20% of the population, they want to receive more information about vaccines. And this is their right. They are not against vaccine. It's their right to know how I can guarantee that the vaccine is safe and efficacious, how we can, and effective, how we can guarantee that their child needs to be vaccinated. So we need to renew also the strategy, the communication strategy that we are adopting. First, we need to also modernize the way that we are dealing with information using not only traditional media, but also social media, because social media nowadays is where many, I don't know, maybe the majority of our population is getting everyday information about the health, and unfortunately is also getting fake news, false information about vaccines. So if we don't change the way that we are communicating, I think that we will not provide the answers that these families request. And also how we can have the health professionals more engaged as advocates for vaccines. Because some surveys that the PAHO and some partners have already conducted in the regions clearly shows that for many families in our region, or most families in our region, the most reliable source that they have to make their decisions about vaccinations is health professionals. How many doctors and nurses in the region can give a proper answer, a simple one, to a family about how they can guarantee that the vaccine is safe? How can, are we sure that not the people that work in the vaccination room? Because when a family arrives in a in a vaccination room, probably they have already made their decision. The problem is when they go to a health center, a health facility for any reason, and they remember that they are close to the vaccination schedule for their children, and they ask a nurse or a physician if they should get their vaccine, and the health professional said, I don't know, maybe, I think that you should, but this kind of answer, I think that is not enough. So we really need to rethink how we can coordinate with the schools of nursery medicine, how we can provide very close collaboration with scientific societies. So how we can get the health professionals as informed, well-informed advocate for vaccines. Not only to tell people, no, you need to get your vaccine. Many people now, they don't like to receive orders from governments or from international institutions. They need to be informed so they can make the best decision for their health. So these are some strategies that I do believe that working together, we will support our member states to strengthen the many advances that they have already implemented, and the figures are reflecting that we are moving in the right direction. After many years of decreasing, so it was not only the pandemic, as was already mentioned, since 2015, 2016, for other countries, even before that, the vaccination coverage rates were already declining. So I think that the increase that we have seen in the recent years, 2021, 2020, 2022, 2023. So I think that now is the moment to build on this recovery process and to get the vaccination rates that we need to protect our population in the Americas. Thank you.
Thank you, Director. Good summary of actions that we can take. I guess everything is involved, from communications to bringing vaccines closer to people that need them in the remote areas, in the slums. I wanted to go back now to our panelists connected with us online for a final message to this year's vaccination campaign. Our slogan is "Engage now to protect your future." What would be, with this in mind, what would be your message to people in the region for this year's vaccination week? How can they engage? How should we engage? I'll start with the Minister of Belize. Kevin Bernard, please.
Thank you once again. One of my message that I would like to share with our people in America is families need to get vaccinated. We want to encourage families to get vaccinated, children and adults across our countries and region. There should be no child or adult that should suffer the consequences of preventable vaccines. And so it is imperative on us as well as governments, as leaders in our country, as ministries, to ensure that we continue to put our efforts as well to ensure that vaccines are made available to every citizen of our countries. And so I encourage everyone, as we celebrate Vaccine Week, to keep a sharp focus on our goals, on our achievements, and our future plans. In the case of Belize, I know one of the things that we have been working on is that we will continue to strengthen our expanded program on immunization so that we can achieve at least that minimum of 95% vaccine coverage. We as well continue to plan to ensure that by first quarter in 2025, that we catch up on the campaigns for polio and measles and other vaccines, considering that in some other countries are already experiencing some outbreaks and reemergence of vaccine preventable diseases. And so we need to ensure that as a region, we continue to push forward, we continue to ensure that we give it our very best. And as a minister, I pledge to continue to ensure that we expand these programs. I continue to support the introduction of new vaccines. For example, we recently introduced the pneumococcal vaccine, and we are working on the introduction of the rotavirus vaccine. And as a government, I have made this very much important in terms of placing it on the agenda of the government, the protection of the population from vaccine preventable diseases. So I really want to take this opportunity to thank everyone and to thank our citizens who have participated, and to thank all millions of persons who have been able to ensure that they are keeping up with their vaccines on a regular basis. So as a region, I think that we all just need to ensure that we remain committed. As Dr. Barbosa just mentioned, we need to ensure that we give it a priority. And the priority is what the region ought to see, that we continue to improve and to increase our vaccine coverage.
Thank you, Minister Kevin Bernard. Thank you very much for your participation. We wish you success in your efforts, of course. I would now like to pose the same question to Dr. Jimena Aguilera of Chile. What would be your takeaway message for this year's vaccination week in the Americas to the people of the region, and how do we engage?
Thank you very much. I'd like to take this opportunity to greet the Minister of Belize, who was here in Santiago 1 week ago, and it's my pleasure to see him on the screen. And there was a summit for health services here. So what messages are my takeaways for this vaccination week? I believe that the organization was very clear, especially in the words of Dr. Salas and the words of the director, as well as the other panelists, stating that vaccines are the best tool we have in public health. We need to continue trying to convince people that vaccination is an effort of society as a whole and not only the health ministry or the health professionals, but rather that we need to involve the entire society in a vaccination strategy, despite the barriers and challenges that have been mentioned. These are shared by all countries, and we need to continue working to solve them. What is most relevant is to ensure that vaccines are understood to be a tool that turns into reality the right to health, the right to enjoy a full life with well-being throughout the life course. It is the very best intervention. We have to have healthy children, healthy adults, avoid diseases in an effective way. So I'm taking away the messages that you mentioned, the strategies also described by the director of PAHO, because indeed it is relevant for it to be an entire society, including the health professionals. They need to be the actors, they need to convince our populations. They are the ones who are the face of health issues and activities. It is their work, but this is a challenge for society to ensure that everybody understands its a benefit to everyone. So that is my takeaway. Thank you very much.
Muchas gracias. Gracias, Minister of Health of Chile, Dr. Aguilera. Now, the same question I would like to pose to the Vice Minister of Health of Venezuela. What would be your takeaway message to the region for this week's Vaccination Week in the Americas? How can we engage more from the side of government or other actors? Thank you.
Once again, thank you. Our message from Venezuela to the Americas is that we believe that tying primary health care is crucial, especially in all the distant territories. It is important to link the community leaders with those teams deployed in each of these areas to provide vaccination. These community leaders can be extremely helpful so that we can know where those unvaccinated children are to be found. This allows us to tackle the gaps. It allows us to not miss out on any vaccination opportunity. I would like to invite all the countries of the Americas to look at an important exercise that we are doing in Venezuela that looks at the coverage according to the dose that has been administered. Thus, we can create new strategies to increase coverage and avoid lost opportunities for vaccination. Let me take advantage of this opportunity to share with you this tactic that we are deploying here in Venezuela, where all the teams are sent out in the late afternoon, evening, when the parents are home with their children. And that allows us to reach out to the parents as well. In our country, no child graduates or even comes out of delivery rooms without them already receiving the vaccinations approved for newborns. This is a country policy that Minister Magali Gutierrez promotes. This increases the trust of the population in vaccines as they talk to the health workers. And I'd like to thank the entire population of Venezuela because they every day trust more in vaccines. They come more frequently to our health centers, and they open the doors to our health staff as they travel through the country. My message to the Americas is that we should always try and find ways to reach the most remote areas, to build confidence amongst our populations, and of course, We must always act to guarantee life and protect the future of our children.
Muchas gracias, Viceministro. Thank you so much to all of our panelists for the participation. I am conscious of time, so we're moving on with our program for this morning. Thank you very much one more time for connecting with us today. We will now hear a video message, watch a video message from Dr. Teresa Tam, Chief Public Health Officer of Canada at the Public Health Agency of Canada.
Bonjour à toutes et à tous. Hello, everyone. Thank you for this opportunity to take part in the launch of Vaccination Week in the Americas 2024. In Canada, an important part of our journey of reconciliation is to acknowledge the Indigenous lands in which we live, work, and play. In that spirit, I would like to acknowledge that Canada is the homeland of First Nations, Inuit, and Métis peoples, and that I am speaking to you from Ottawa, on the unceded traditional territory of the Algonquin and Anishinaabe people. Au Canada, comme dans nombreux pays du monde, la pandémie de COVID-19 et les épidémies de rougeole en cours ont démontré l'impact profond des vaccins sur la santé publique, y compris l'importance de maintenir une couverture élevée avec les vaccins qui existent et de continuer à développer de nouveaux vaccins. We know that investing in actions that reduce barriers and improve access to vaccination is an investment in the long-term health of our communities. The work that we all need to do to improve health equity and address social determinants of health is complex and takes time. Vaccination is one tool that can reduce gaps in health outcomes when it is made accessible to everyone, starting from their earliest days and throughout their lives. We know routine childhood vaccination has been an enormous public health success, saving many lives. But this progress was impacted by the COVID-19 pandemic. The challenge now is to close gaps in coverage that emerged to keep children healthy. Building on this, many countries are also looking to bolster vaccination across the life course. This is why this year's theme of Vaccination Week in the Americas, focusing on vaccines as part of an active and fulfilling life, resonates strongly with me. These efforts will support people to enjoy longer, healthier, and more active lives. It is also important that the positive impacts of vaccination are accessible to everyone in our communities. In Canada, this includes working to reach those who have limited access to healthcare services, like people who live in rural and remote communities. We all face challenges to realizing the full potential of vaccination. Addressing the spread of mis and disinformation is key among them. Going forward, we have an opportunity to support community-led initiatives that reflect local priorities and strengths. I am pleased that Canada continues to support PAHO in its important work, enabling regional experts to implement community-focused vaccination efforts.
Thank you, Canada, for the message and the support to vaccination efforts in the region. We will now show a video about vaccine operations in Ecuador post-COVID-19.
The COVID-19 pandemic was a challenge for us all, but it also reminded us how important public health is. In Ecuador, we don't only combat the virus, but we also work to protect our children from other preventable diseases. In 2023, the Public Health Ministry launched the vaccination campaign with high-quality follow-up against measles, rubella, and polio. This campaign, targeting those under 12, wanted to help and detect those that did not complete their vaccination schedule during the pandemic, that is, children born between 2011 and 2022. The campaign was declared public interest and a priority to the country. Careful planning, efficient performance, and active participation of the community were key for the success of the vaccination campaign. Furthermore, interagency work between government, academia, and health professionals and international organizations was crucial. Over 3.4 million children were vaccinated in 14 weeks, reaching 99% coverage. This means that Ecuador has taken an important step forward to eliminate these diseases. In New Ecuador, we guarantee the supply of vaccines that are part of the regular vaccination program that are procured through the PAHO WHO revolving fund. The shared commitment to protect the health of Ecuadorian children and achieve elimination and eradication of vaccine-preventable diseases is supported by the Pan American Health Organization, that this week is celebrating the Vaccine Week in the Americas. All these actions are thanks to the capacity of the health teams for safe administration of vaccine, effective communication with the population, and to be aware about all of these vaccine-preventable diseases. In this Vaccine Week of the Americas, we invite everyone to go to health centers that will be deployed throughout the country. Recall that each vaccine counts. We count on your support during the week of vaccination in the Americas 2024.
Nice to see some local actions to boost vaccination with the support of PAHO and its revolving funds. We now come to a final message from our member states. I invite you to watch a video message from Dr. Eladio Perez, Vice Minister of Collective Health of the Dominican Republic.
Morning, everyone. It's a pleasure to greet Director General of PAHO, Dr. Barbosa, and his team who have organized this event so as to jointly and regionally launch the Vaccination Week in the Americas. It is very important for us, the countries, members of the organization, to continue strengthening the vaccination programs. As you know, vaccines are the main tool for public health in recent years. Not only has it been a preventive tool, but furthermore, it has achieved impact mitigation. So it's important that we continue investing in the health of our peoples with vaccines that are more effective. We have seen how even during epidemics, we are able to work to prevent an expansion by fencing the disease. And we also have access to other technologies thanks to the revolving fund and the strategic fund of PAHO. Thanks to these joint purchasing funds, we can benefit from better technology and provide better health to our population. This week, let us take advantage in order to increase our vaccine coverage to guarantee greater access and equity in the delivery of public health services. As we heard, we need to engage now to protect your future. Get vax.
Thank you, Vice Minister, for this message. We're now coming to the end of our program for this morning. I would like to invite Dr. Barbosa to close the ceremony with a few parting remarks and answer the question, perhaps, Dr. Barbosa, where do we go from here?
Thank you, Luciana.
I would like to start by thanking each one of our esteemed guests, panelists, for having taken part in this ceremony of the launch of the 22nd week of vaccination for the Americas in 2024. Your contributions and your support to the national immunization programs in the region of the Americas have been very important and continue to benefit to protect our communities. On this opportunity, I would like to remember our colleague, Dr. Guautomic Ruiz Matus, who, as many of you know, we lost at the beginning of this year after a long battle against cancer for 15 years. He headed up the regional immunization program of the Pan-American Health Organization and contributed to the elimination of many diseases, such as neonatal tetanus, rubella, and the congenital rubella syndrome. He always was a staunch supporter of the Vaccination Week of the Americas, and this is a very important initiative that he stressed with a celebratory tone. At the beginning of this program, 22 years ago, the Vaccination Week was a key aspect that provided vaccines to more than 1.15 billion people throughout the region as a fundamental part of health services, especially primary health care. National immunization programs have been carried out among other health interventions, such as deworming and so forth. Now, history has taught us that when we work together, we are better positioned to meet our common goals and enhance the health of our population. As many know, and as we heard this morning in Dr. Daniel Salas's presentation, the vaccination coverage rate in the Americas was already dropping at a concerning rate before COVID-19. Currently, our greatest effort should be focused on recovering our performance of immunization throughout the region and to maximize its efficacy and efficiency. Disparities in coverage that exist within and between communities, together with insufficient vaccination of children, can lead to new outbreaks.
I will continue now in English. Thankfully, due to the commitments and tremendous efforts put in place by our countries, the Americas is showing signs of progress in recovering vaccination coverage rates. Regional coverage rates have reached the pre-pandemic levels, and the number of under-vaccinated children is at its lowest since 2018. These efforts are also a key element in support of PAHO's elimination initiative. PAHO is working with the countries and territories in the region to eliminate more than 30 communicable diseases and related conditions by 2030. Of these, 11 are vaccine-preventable diseases, including cervical cancer, measles, poliomyelitis, rubella, and congenital rubella syndrome. In 2019, the policy on the PAHO disease elimination initiative was approved by our member states. And in 2023, PAHO relaunched it with a renewed and stronger commitment during our directing council. PAHO is currently working on expanding several areas of its technical capacity to reach our own control and elimination goals, as well as to implement the strategic priorities of the Immunization Agenda 2030. These include expanding the conversation on immunization beyond childhood, so that persons of all ages are able to reap the benefits of vaccinations. Using geospatial analysis to improve microplans and bring immunization services to chronically underserved populations. Strengthen national surveillance networks for events supposedly attributed to vaccination or immunization, so we continue to access the safety of our vaccines rapidly and precisely. Expanding the number of diseases that can be tackled through the use of vaccination. Investing in vaccine development and production in the Americas to prevent stockouts and to prepare the region for the next pandemic. On our road to recovery, it is imperative that member states continue to prioritize and to invest in their immunization programs. The support and strong commitment from our friends and partners essential during the COVID-19 pandemic, must not waver now. We must continue to work together to ensure that everyone across the Americas has access to quality vaccines and immunization services. As PAHO's director, I am committed to continue our untiring support to the countries and territories of the Americas through technical leadership and cooperation. We will deliver on the expectations placed upon us, faithful to our mission to promote health equity, to combat disease, and to improve the quality of and lengthen the lives of the peoples of the Americas. I want to recognize our staff here at the headquarters, the immunization special program, revolving fund, procurement, but also all the people that work together in this building to strengthen the immunization initiatives in the Americas. And I also want to recognize each one of our staff in the country office that during this week will be working with the Ministry of Health, reaching the populations that are being left behind, increasing the access, removing barriers, working with the Ministry of Health to strengthen the regional and the national immunization program. So thank you very much for your time and presence. Let's engage now to protect our future. Thank you.
Thank you very much, Director, for those closing remarks and strategic direction of where we go next. From PAHO side, Excellencies, ladies and gentlemen, our audience online, we have come to the end of our program for this morning. It's been encouraging to hear, Dr. Salas, that we've made progress in vaccination, but seems we still have a lot of work to be done. It's been encouraging to hear that there's commitment from the video messages on our member states to work together to turn the situation around. I hope next year when we gather again, we can see a lot of achievements, improvements, even more improvements in vaccination coverage. I would like to close by thanking again the panelists that participated today, all the audience here in the PAHO building as well as online, and also thank our immunization team for organizing the ceremony today, our interpreters and technicians. Thank you for making this happen. We appreciate everyone's commitment to immunization. For those in the room, the good news is there will be some refreshments served after this. You will find them downstairs to the right, offered by our immunization team. Thank you again for your attention and a very happy 22nd vaccination week in the Americas. Thank you.